World Dental Day, celebrated annually on March 20 with the theme, A Happy Mouth is a Happy Mind. Today serves as an international observance dedicated to raising awareness about the importance of oral health and promoting good dental hygiene practices worldwide. The day was established by FDI World Dental Federation in 2007 to highlight the critical connection between oral health and overall well-being. As a global health issue, dental care continues to be one of the most underemphasized areas of health, yet it plays an integral role in preventing various diseases and promoting a better quality of life.
So when we talk about dental health, we're talking about the condition of the teeth and the supporting structures of the mouth. The teeth in itself, that is what most of us focus on. Besides that, we also have supporting structures of the teeth, like the gum, the bone. There's what we call the periodontal ligament, the cementum. So the health of the teeth and the structures that surround the teeth, the oral mucosa, that's the other parts that line the mouth, the tongue, the gums, everything that makes up the mouth, everything that makes up the oral cavity. The state of these conditions tells us about the dental health of an individual. Another interesting thing to note is that dental health is not something that is taken care of or that is in isolation. Dental health affects the systemic health, and this makes it even more important because there are links to poor dental health and heart conditions. They could be linked to poor dental health and pregnancy complications. Another thing on the flip side is that the mouth can be a mirror to the body. So for certain people that have certain systemic conditions that are not properly managed, we can tell from looking at the mouth. We can suspect, we can have a high index of suspicion by looking into the mouth. For example, for some individuals that have poorly controlled diabetes, when they come to dental clinic, you notice that they could have multiple abscesses. There's multiple areas where pus is coming out from. Some of them have teeth that are shaking. You see that most of their teeth are shaking, for example, or an area. You just notice that, there are abscesses here and there, multiple abscesses. You can see that there are multiple teeth that are shaking in these people, that are mobile in these people. Another thing is some individuals have HIV, and there's certain lesions, there's certain things we see in the mouth that make us know that this person might have HIV, and then we send for test and it's confirmed that these individuals have HIV. So that tells us how important, or the interconnection between the oral health and the systemic health. So if you don't take care of the system, it will be shown in the mouth. If you don't take care of the mouth, it can worsen or cause some systemic conditions. So taking care of your mouth is the same thing, or it's linked to taking care of your body, and vice versa. Many misconceptions about oral health, which vary from location to location depending on where you find yourself. Some common ones are that the harder you brush your teeth, the more energy you put into it, the cleaner your teeth will be. That is not true. Ideally, medium bristle toothbrushes and fluoridated toothpaste should be used in brushing teeth, using the correct strokes, brushing away from the gum gently. That is sufficient to clean the mouth, and it should be done twice a day, last thing at night after eating, and in the morning also. Another common belief is that if your teeth doesn't hurt, you don't need to go to the dental clinic. I've seen a lot of patients that said, when I ask them, why didn't you come all the while, they say it was just a hole, it wasn't painful, and they've come now because it's painful. And at that stage, more advanced treatment is needed, more money is spent, a lot of pain has been gone through, which could have been avoided. Another thing is some people believe that the baby teeth doesn't matter. It's the baby teeth that has a hole. Why do I need to take care of it? They believe that the adult teeth is the only thing that matters. But that's not true. Baby teeth serves as a foundation, as a scaffold, so to say, as a supporting structure for the adult teeth to ensure it comes out in the right place and it comes out sound. If you don't take care of the baby teeth, in some conditions, some people, it leads to what they call Turner's teeth. You see the baby teeth being affected, and the adult's teeth comes out in the wrong position or not as developed as it should be. And in others, the adult teeth comes out in the wrong place because the baby teeth that are supposed to serve as a guide to the adult teeth has been lost earlier on. So it's very important. Another thing is, if a wrong attitude is developed from childhood, if the primary teeth is not taken care of because the baby didn't take care of the child, didn't take care of the primary teeth, if those same attitudes are not changed, then the adult teeth will also come down with dental caries, just like the baby teeth. Other common ones that people have also is, if I remove one teeth, I'll remove the others. That's a worm that is causing disease that is moving from teeth to teeth, and that's very wrong. If you stop the characters, if you stop the behaviors that led to the decay of the baby teeth, of the initial teeth that were removed, then you don't expect other teeth to be affected. So these are some of the common myths that are heard, that are commonly said about misconceptions commonly said about the oral health. Teeth and gums. Yes, diet plays a very important role. We know that calcium is very important for bones. The bones, there are bones in the mouth. So for the bones in the mouth, the alveolar bone to develop properly, yes, the individual needs calcium. Likewise, the teeth also needs calcium to develop very well. Some of us know that the outermost part of the teeth, is the strongest structure in the body, and so it needs calcium for it to maintain its structure, to maintain its strength. And other vitamins are also important. Vitamin C is important for our gum health. So generally, eating food that is balanced, a balanced diet, will help to not only support the teeth but other structures in the mouth. On the flip side, taking sugary things, taking acidic foods wear down the enamel of the teeth, wear down the structure of the teeth, and with time, these teeth are susceptible to developing dental caries. So in a nutshell, eat a balanced diet, reduce sugar, reduce acidic foods, and it reduces the risk or likelihood of coming down with erosions, with sensitivities, with cavities, with pain, and one will have a healthy body, a healthy mouth also. Now, what are the signs, the early signs of gum disease, and how can we prevent them? Early signs of gum disease include swelling. The gum is swollen, the gum is red, the gum feels painful, feels tender, the gum is moving back, feels like it's moving from its original location, or the gum is bleeding while brushing. Another one is bad breath, halitosis. These are early signs that there's something going on there, that is a gum disease that is taking place. And how can it be prevented? Good oral health. Taking care of the mouth, taking care of the health of the mouth can prevent gum diseases, can prevent periodontal disease, that is diseases of the surrounding structure of the teeth. Number 1, brush twice a day, last thing at night and in the morning. Another thing is to floss. Do not use toothpicks to remove food from between your teeth. Use the dental floss, the thread-like part in the dental floss, and not the plastic sharp edge. It should be taken between the teeth and gently raised up and down to remove anything that is stuck between the teeth. Another thing is regular scaling and polishing. This should be done every 6 months, that is twice a year, and regular follow-up in the dental clinic. So if there's anything going on, it can be picked fast, and this reduces the risk of coming down with gum disease and periodontal diseases. So that's an important way. These are important things to do to prevent gum disease. One mistakes that people make when caring for their teeth at home. Many people use hard toothbrushes. They feel if you don't use the smoker's toothbrush, their teeth is not going to get clean. Or if you don't put so much force, like they're trying to wash something very hard, the teeth will not be clean. Another thing is skipping flossing. So people just use toothpicks. They keep using toothpicks. They feel if you don't use toothpick, it won't get the food out. So that's another thing. Skipping flossing, not using dental floss. Just leaving the teeth like that, or using broomsticks, using matches, sharp objects, needles and co to remove things stuck between the teeth. That is a mistake that many people make. Many people use too much toothpaste. They feel the more toothpaste, the more the teeth gets clean. And if this is done in children especially, it can lead to fluorosis. It's not even good for an adult to use excessive toothpaste. They can be toxicity if it is used in very high amounts. Another thing is to brush for 2 minutes. Some people just brush 30 seconds, or they just brush 20 seconds and off they go. You should brush for 2 minutes, making sure to brush thoroughly and not leaving any area untouched. Another thing is people neglect dental visits. They feel dental visits, going for dental visits is a luxury. It's not something you do that everybody should do. It's rich people, so to say, or people of the higher socioeconomic class that should visit the dentist, and this is very wrong. Everyone needs to visit the dentist every 6 months. That is twice a year. So that's something that we should not neglect. Visit the dental clinic regularly, at least 2 times a year. If all of this is done, you are sure to have a healthier mouth. And this reduces the stress on you of missing work, missing school, and all of that, because one has to keep going for dental visits to take care of diseases that have come up.
Hi, I'm Dr. Joe Nemeth. I'm a periodontist in Southfield, Michigan. Probably most of the patients that I see for gum recession, let's call them, are clean freaks. Their mouth can't be clean enough, so they brush and they brush and they brush, thinking it's going to be healthy. Well, there's such a thing as too much brushing. And very frequently, if one's gum tissue is thin and you brush too often, you brush too hard, you brush too long for, or the toothbrush is too hard, you're going to actually abrade that tissue. You're going to cause gum recession. So too much brushing is one of the major causes of gum recession. Too much brushing, too frequently, too hard to brush, that sort of thing, especially if your gum tissue is thin. Also, if you're brushing and you're getting recession and you're using toothpaste, almost all toothpastes have abrasive, and I've mentioned this before. I do not use toothpaste when I brush because there's abrasive material in almost all toothpastes, and that will cause notching, or actually cutting away into the root of the tooth. So if you have some recession and the root is exposed, you're brushing with toothpaste, that can cause notching or cutting away some of the tooth structure. And if you cut away too much, actually that tooth could fracture, just like cutting a tree in the forest. My assistant Sue is right here. Let's take a picture of Sue because she's so beautiful.
Hi.
What did you tell me about the water pick, Sue?
If it's used incorrectly, if it's not used in the proper direction of the water flow going directly in between your teeth, if the water is actually aimed up at the gum or down into the gum, that can also cause damage.
Right, particularly if your gums aren't healthy, if your gums are inflamed, that water pick can actually drive bacteria and infection deeper into the gum if you're infected and not using it properly. We do recommend a water pick, but we recommend it when the gums are healthy and to use it properly. So mouthwashes that contain alcohol, possibly. Alcohol can actually dry out your mouth, and in some cases where tissues are tender and sensitive, it can actually cause irritation of the tissue also. Didn't we talk about hydrogen peroxide too?
Using hydrogen peroxide full strength is never a good idea. You always want to dilute it with some water. It can be too abrasive again on the gum tissue, causing irritation.
And also, people who gargle with hydrogen peroxide very regularly actually can kill so many bacteria, the good bacteria, that one gets what is called black hairy tongue. It doesn't sound great. It's not great. It's not really dangerous, but it's not a healthy situation because you're killing off the good bacteria, allowing fungus and bad bacteria to flourish, and you can get black hairy tongue from overuse of hydrogen peroxide. Also, Sue is mentioning about flossing.
Too aggressive of flossing, if it snaps up into the gum, it can also irritate the gum, causing it to swell, and then go ahead and causing it to recede. So you want to just do it very, very gently as you go through the contacts.
Also, if you're flossing too often or improperly, you can injure the gum tissue, causing that gum tissue to shrink, causing black triangles or spaces between the teeth. And when you've got black triangles or spaces between the teeth, they're very, very hard to correct because at that point there's usually no bone in those areas, and so there's no blood supply to nourish the tissue that we try to bring up to cover the roots and fill the spaces as much as possible. Brushing is good. Keeping your mouth healthy is critically important, but you can't overdo it. So just be really careful. People have to know how to clean and brush their teeth if they have a problem with gum recession. Too many people scrub too hard or scrub the wrong way and cause the gum recession or cause it to get worse. If you have gum recession, don't scrub hard, don't scrub around, don't scrub back and forth. On the upper, scrub down, like you're bringing the gum down. And on the bottom, scrub up, like you're bringing the gum up. Same thing on the inside. So that's the tip for the day. Very careful with your brushing, soft brush. I do not recommend an electric brush for anybody with a gum recession problem. You can't control it so well. So a soft manual brush, brushing carefully, will give you your best chance of avoiding gum recession and preventing it from getting worse if you already have it.
Health. Oral health is not merely about having a bright smile or fresh breath. It's a vital component of a person's general health. Poor oral hygiene can lead to an array of health problems ranging from gum disease to severe conditions such as diabetes, heart disease, and even complications in pregnancy. Research has shown that oral health is linked to the overall health of the body, and taking care of your teeth and gums can help reduce the risks of systemic conditions.
So how often should one visit a dental clinic? Dental clinic should be visited at least twice a year, every 6 months. And for those with high risk of caries or high susceptibility to caries, they have high risk, we advise that they visit dental clinic every 3 months. So at the least twice a year, every 6 months. But for those who have higher risk, it can be as frequent as every 3 months, which is 4 times in a year. This is important for your scaling and polishing to be done. Aside that, early signs of disease are picked. Early signs of cancers, early signs of caries, early signs of gum diseases are picked on time if one goes to the dental clinic as he or she should. So it's very important that we all go to the dental clinic at least twice a year, and for those with higher risk, 4 times a year, which is every 3 months. I believe if we catch them young, we are better able to pass information across, doing outreaches. So that's something we did a lot in our undergraduate years, visiting primary schools, on World Oral Health Day especially, and other days too. We go to schools, teach them how to brush their teeth, give them toothbrushes, toothpastes, encourage them on their oral health. We do free checkups for them, let them know if there are any issues and how they can access help. So these are very important ways to get these children informed about their oral health early enough. And also the parents of these children, especially for the younger ones, they are the ones to be educated so that they do not neglect the health of their children. So very importantly, going school by school for school outreaches, very important, demonstrating how to brush your teeth, letting them do it on the spot there, reinforcing this information by regular outreaches, and also finding a way to also discuss with parents, maybe during the PTA meetings or through outreaches in the workplaces of these parents, to ensure that these children are not neglected or left behind as regards their oral health. Myths is that it is rich people that go to dental clinic, that our dental clinic, it's rich people that go there, and that's wrong. No, that's not true. That's bias in the mind, keeps a lot of people away. Another problem is that in some areas, in rural areas, dental clinic is not it's not so accessible as a an average medical center or health center will be accessible. So in some areas, in some rural areas most especially, the dental clinics are not very accessible. But the beautiful thing is that daily dental clinics have been opened up, and I can say for sure that more dental clinics are accessible now as compared to before. Another thing is some people are scared of coming to dental clinic. They feel they will go through pain. They feel everything the dental clinic is about pain, and that's not true. Depending on what disease the individual comes with, Sometimes you don't even need to have an injection. It's just a simple feeling. It's just a washing of the mouth, just cleaning and polishing, and all these things. It could just be fissure sealants, it could just be fluoride therapy, and all these procedures are not painful. And for the seemingly painful ones, we give injections with very thin needles, and this helps the patients to tolerate these procedures without feeling pain. There may be pressure, but we ensure that no one feels pain as much as possible in the dental clinic. So if you are there being so scared about coming to the dental clinic, about taking out that tooth, or about addressing that pain in the mouth, I advise you come around and have it looked at. It's very important that you have a healthy mouth so that you have a healthy mind, a happy mind. Yeah. For those that know, World Oral Health Day is March 20th every year, and it's something that we celebrate all around the world every year. And the importance of World Oral Health Day is basically to raise awareness about oral health, to encourage healthy oral health practices. It's an opportunity for us to go out to the communities and tell them about their oral health. In some cases, treatments are done at subsidized rates to encourage people to take care of their oral health. It's a chance to bring dentistry to the community, to encourage people to take care of their oral health. The theme for this year is a happy mouth is a happy mind, and this theme emphasizes the importance of oral health to mental health. If you take care of your mouth, your self-esteem is maintained, is even increased. Your mental well-being is optimal. You are confident, you're not worried about, is my mouth smelling, can I go out, is my teeth white, and all of that. So if you have a happy mouth, if you have a healthy mouth, you definitely have a happy mind. A happy mouth is a happy mind.
Is more than just a celebration, it's a call to action. It reminds us that oral health is essential not only for a beautiful smile, but also for overall health and well-being. By promoting awareness, education, and equitable access to dental care, this observance aims to reduce the global burden of oral diseases and improve quality of life. As we celebrate World Dental Day, it's an opportunity for individuals and communities worldwide to reflect on the importance of maintaining good oral hygiene habits and to advocate for policies that ensure everyone has access to the dental care that they need. Happy World Dental Day.